There are a lot of factors which are involved in the transition of care. The provider-related factors are related to education of the patient, particularly being sure that the patients and their families understand the disease process itself. They need to be educated as to the purpose of therapy. They need to understand what the therapies are for, why the use of the medication strategies are significant. And they need to understand that the adherence to the medication regimen is extraordinarily important to the long-term outcome. Gone are the days of telling the patient, just do this. In the land of patient-centered care, in the land of shared decision-making, we have to educate our patients and their families. We have to make them part of the care team so that they are able to continue to participate after they have gone home, so that they are able to be contributing members to the team, communicating to the provider what's occurring. And it's our responsibility to initiate that at the outset. There are also factors that are patient-related as relates to the transition of care. Patients bring different levels of experience and different levels of sophistication to the healthcare team. It's imperative that the patients be allowed to understand at their level what is occurring, what has happened, and why adherence is so important. Psychosocial factors are extraordinarily in play, particularly early after a disease process has initiated. Oftentimes, there has been a life-threatening event take place, and that creates tremendous fear in the patient, tremendous fear and anxiety in the patient's family. There are physical and mental issues which come into play as well. Sometimes patients have difficulty physically accomplishing the things that are necessary. Sometimes they are forgetful and have difficulty remembering simply to take medications. There are other factors, such as economic factors, which create great anxiety. Insurance factors, policy coverage determinations, formularies, co-payments are usually foreign to patients and their families until it is thrust upon them by the illness. We have to help the patient and the family understand and navigate these very troubled waters as they move from the initial event to the transition to home and back to good health.